So some basic research behind the RARM and why it's so powerful. And it really is such a powerful technique that when you learn how to use it, your clients will be amazed at how wonderful you are. So I started using it in my therapy room a number of years ago to resolve anxiety issues that clients were coming in with. I trialled it many times and I used many different types of methods just to try and get them to feel better as fast as I can. I used a combination of NLP, counselling and psychotherapy techniques and hypnotherapy techniques. And while combined they were working really well, I still wasn't getting the results fast enough for what I thought my clients deserved. So the results when I started actually putting together the RARM that we're teaching today were astonishingly fast, and they were long term. Now the paper that I've written, the journal article that I've written, does suggest that a longitudinal study be done, because what we're doing as therapists is understanding what the client is experiencing, having the RARM undertaken in the room, and then contacting them a few days later to make sure that their anxiety has significantly reduced and they've been able to undertake the experience or event that they were wanting. But we still really don't know how long-term the RARM works, although I must say many of my clients will come in for a variety of different things, and because I live locally and I get out and about, I do sometimes see my clients. And they will come up to me even a couple of years later now and say, because I've been doing this for a while, and saying that issue that I had, it's just gone and it's never even shown its head again. It is completely eliminated. So while I believe and know from the clients that I've spoken with and been in contact with that the anxiety has never returned, I can't say that there's been a full and formal longitudinal study. That's something that I will be doing in time to come. But I wrote up a formal instruction paper, and the reason I did that was because of the training that we do in the Australian Hypnotherapy College, and we have psychologists and some doctors and social workers, counsellors and so on doing our training, as well as lay people. I wrote it up in a formal manner like we're sharing with you today. Plus, they had to do assessment tasks, they had to practice in the room with each other, and they had to go out and find clients or family and friends or patients, if they were psychologists, to use the RARM on, so they could write up their responses for part of their assessment. The results were astonishing, not only to the therapist that was training, but to us as well. Issues that we didn't really think of using RARM on were being addressed, and some of those are being mentioned later on in this training. But the variety of issues that people are coming in for and our students were using with RARM with such incredible results have really blown us away. Hence, we thought, instead of just training within the college in our clinical hypnotherapy course, we are training everyone to use this, and the more people around the world that can be trained in this RARM and use it for clients, the better off people are going to be.